In life, if you can't make choices that improve the society or improve people around you, but you can at least make a choice that improve yourself, a choice that improve your productivity, a choice that improve your health. Welcome to this channel, welcome to this episode. My name is Charles Willis Uhuru, a wellness expert and a laboratory professional. This is a channel where we discuss about your health, how you can improve on your health, choices that you can make in life that will help you live longer, that improve on your productivity, that will make you prevent some of these health conditions that are affecting people nowadays. Welcome to our today's episode, and if you like what I do, just hit the subscription button and share the information to other people. In our today's episode, I'm going to focus on diabetes. Diabetes is one of the global condition and the most understood health condition in the world today. It affects people globally, and it is a condition that develops as a result of your diet, and thus it is a dietary condition. And in today's topic, we will discuss what it is, how it develops, how you can prevent it, how we can diagnose it, and some of the risk factors that will make you develop diabetes. So when I say diabetes is a dietary condition that results from you taking too much sugars into your system. So how does diabetes develop? In your body we have an organ called pancreas, and this pancreas normally produces an hormone called insulin. The beta cells of the pancreas produces an hormone called insulin. This insulin is what helps in removing sugars from your bloodstream. That is, after digestion and the sugars have been loaded into your bloodstream, the insulin will help remove the sugars from your bloodstream into your different cells for energy production and storage. They are stored for energy productions that can be used later in different processes, activities within your body, metabolic processes, and even you, to help you in performing your various activities. So with diabetes, this insulin is either not produced at all. The beta cells of the pancreas have been damaged and the insulins cannot be produced at all, leading to you developing what we call type 1 diabetes. Type 1 diabetes is normally an autoimmune condition that results from the damage to the beta cells of the pancreas, thus your body not able to produce insulin at all. It is an autoimmune condition. It is rare, but when you develop it, you have to be on insulin for the rest of your life because your body can no longer produce insulin at all. That is type 1 diabetes. Then we have type 2 diabetes, normally referred to as diabetes mellitus, which is the most common type of diabetes in the world. Approximately about 90% of diabetes cases have got type 2 diabetes, and this diabetes is as a result of your body not able to respond to the insulin produced by your beta cells of the pancreas. The insulin is produced, but your body does not respond to the insulin production, or the beta cells of the liver does not produce enough insulin to remove the sugars from the bloodstream to cells for energy production. So that is the type 2 diabetes, or the diabetes mellitus. So your body is somehow resistant to insulin production. It does not respond to the insulin produced. Number 3 type of diabetes, we normally have the gestational diabetes that normally develops during pregnancy. It only affect the pregnant women develop during that period. It is a type of diabetes that can easily be managed by just your lifestyle and the foods that you take, and it disappears moments after delivery. But if you are not careful enough in how you take care of yourself, it might lead to type 2 diabetes, or the diabetic mellitus, later in life. So for gestation diabetes, you just need to check on your diet, you do some exercise, maintain your weight and all that, to ensure that it does not lead to type 2 diabetes. So there are 3 types of diabetes. We have the type 1, the autoimmune diabetes, we have type 2, the diabetes mellitus, and we have the gestational diabetes. So that is how these 3 diabetes develops. So when we talk about sugars in your diet, there are normally around about 3 or 4 important nutrients. We have the carbohydrates, we have the proteins, and we have the fats, and as well vitamins. Carbohydrates is majorly made up of sugars, and these carbohydrates is what introduces sugars into your system. Carbohydrates' major function is just energy production. So limiting the amount of carbohydrates that is take is one of the steps towards preventing you from developing diabetes. All the carbohydrates that you know, from the wheat, the corns, the rice, the ugalis, the normal table sugar, the sweet fruits, the sweet snacks, especially the processed snacks, they normally contain a lot of sugars. And research shows us, for example, rice, a bowl of rice has up to 10 teaspoons of sugars that you will introduce into your system if you take it. So it does not necessarily mean that you have to avoid taking the table sugars. You find that these other foodstuffs also, other carbohydrates, are a lot of sugars in them, and therefore you need to control the amount of carbohydrates that you take. You only need to take what your body needs for energy. Too much of carbohydrates is a risk and a danger to you, and it puts you at a risk of developing diabetes. Diabetes normally comes with a lot of complications, and if you check some of the chronic conditions that we have today, from heart failure, chronic kidney disease patients, to hypertensive patients, to patients with nerve diseases, liver problems, all these chronic conditions, a good percentage of them have diabetes. So diabetes is one of the risk factors that will lead you to developing some of these chronic conditions. Managing diabetes and ensuring that you don't develop diabetes is one of the major steps towards controlling some of the chronic conditions that are so many in the world today, and so many people are affected in the world today. So it is important that you note that so how does diabetes express itself? It normally develops very silently. It develops very silently, and by the times you start to feel the symptoms, it means when it has developed greatly. That's why it is important that you do a regular checkup, a regular monitor of your vitals, and that include your blood sugar levels. And that brings me on how we can diagnose diabetes, or how we can screen for diabetes. There are normally 4 tests that we do to diagnose diabetes. Test number 1 being the fasting blood sugars, whereby you check your sugar levels after a period of fasting, about 9 to 12 hours. Before you take anything, you check your blood sugar levels. That is number 1 test for diagnosing diabetes. Test number 2, we have the HbA1c, the glycated hemoglobin, where it shows the average blood sugar levels for a period of about 3 months. It gives the average blood sugar level for a period of 3 months, and when it is high, it indicates automatically that you are already developing diabetes. Test number 3, we have the oral glucose tolerance test. Oral glucose tolerance test. This is where you are allowed to fast for about 9 hours. Then after that, we check your blood sugar levels. Then you are given a drink that contains glucose to take, contains a measured amount of glucose to take. Then we monitor your blood sugar levels after a period of 30 minutes, 1 hour, 2 hours, just to try and determine how well your body processes sugar. That will also help in diagnosis of diabetes. And test number 4, we have the random blood sugars that you just check anytime without restrictions, and this mostly helps to monitor your sugar levels, especially those who are living with diabetes. So what are some of the symptoms of diabetes that if you feel, then it might indicate that you are maybe developing diabetes? One of the symptoms include frequent urination. You have a lot of thirst, you drink too much water. Blood vision. You have ulcers and wounds that does not heal faster. So all this symptom arises due to some of the physiological processes that happens due to too much sugars in your bloodstream. You feel tired most of the time. Remember, energy production is affected, so automatically you are going to feel tired. Wounds does not heal. All those require energy. You have frequent infections and all that. And remember, these symptoms takes time to start appearing. That's why it is important that you do regular checkup. You don't have to wait for the symptoms to appear. So what are some of the risk factors that can lead you into getting diabetes? Most of these risk factors are just based on your lifestyle. From being overweight to eating poorly, having a poor diet, you are taking too much carbohydrates, too much sugars, family history. There are some that are connected to your family history. We have age, especially the old. We have blood pressure, high cholesterol levels. So most of these things are just as a result of your diet. They are all linked to your diet and your habits. You don't involve yourself in any workout or physical exercise. You just eat poorly. You just get overweight abnormally. You don't do any checkup on yourself. All these things puts you at risk of developing diabetes. So you need to make it a habit of doing exactly the opposite. You limit carbohydrates to taking only what your body needs. And most of the time your body normally needs a very small amount. And you give your body time to utilize some of the stored carbohydrates and stored sugars. You increase the amount of time between your meals so that your body can deal with the already stored sugars within your cells and within your system. You do exercise. Normally recommended that if you can't maybe go to the gym, but at least you can walk 30 minutes a day. Do some workout. Manage your weight, trying to reduce your weight as much as possible, especially those who are overweight. Reduce the amount of calories you take. Reduce the amount of snacks that you take. And if possible, try to avoid them completely because they contain high amount of sugars in them. So all that will help you or protect you from developing diabetes. Rule number 1 is to manage what you take in. The most important thing. Because if you check at some of these complications that it comes with, most of them are very difficult to manage. But the good news is that most of these things are preventable based on your life choices. Just choose to do exercise. Just choose to eat properly. Just choose to go for regular checkups. Just choose to manage your weight. And you will avoid most of these problems. You will be more productive. You will increase your lifespan and all that. So management, I normally recommend the first management process for diabetes is to you taking initiative of managing your lifestyle, managing your diet, managing your weight, managing everything around you, all that. Exercise daily, medical checks up, all that before you get into taking medication. And you will thank me for that. So that's all about the necessary information that you need to know about diabetes. And for those who have already developed diabetes, it is not a life sentence. You can still live healthy. You don't have to give up. You can still do exercise. You can still eat properly, and you can take your medications as prescribed. Reduce the amount of carbohydrates that you take, not necessarily sugars as a term, but carbohydrates, since they majorly contain sugars. Thank you for watching this episode, and if you have any question, let me know. Keep following, keep watching, keep in touch. Until next time, thank you.